Money-driven medicine, the real reason health care costs so much. During their summer recess, if every member of the House and Senate would read it before returning to Washington, the outcome of the health care debate might be very different. In this broadcast, we will share with you a film based on Maggie Mahar's work. The book and the film couldn't be more timely as our country wrestles with what to do about money-driven medicine.
All right, I'm Dr. Northfleet, and Joel has been talking to you about the belly pain that you're having right now.
Yes, ma'am.
Is this the same kind of pain you've had before, Mr. Woolsall?
No.
Okay.
It started about a month ago.
The pain you're having now?
Yeah.
And who's your primary doctor?
I don't have one right now.
Okay. Have you been admitted to the hospital before, though? You've been here before?
I was admitted to the Centennial Hospital.
Okay.
I had chest pains, and that's when they found the hepatitis.
Oh, boy. Hepatitis B or C or
both?
Wow. You have a history of ulcers, anything like that?
No, ma'am.
And you haven't seen anybody else about this, huh?
No, ma'am.
Okay.
I went to the downtown clinic because when this happened, I wasn't able to work. I lost my job. I lost my apartment.
Okay.
And so I'm just trying to get help.
Yes, sir. We're going to help you, okay? He's complaining of vomiting blood. It's been going on a month, so it's not really considered an emergency anymore. It's considered a chronic problem. But we get a lot of patients like that the emergency department is the only place they know they can go to maybe address their problem. He didn't have the luxury of having a primary care provider, which is a luxury in this country, which is kind of sad. We're like the richest country, and a lot of our people don't have doctors, so they use the emergency department in order to see a physician.
You've got a lot of congestion there in the back of your throat. You feel like it's kind of sitting there?
Well, that second to last tooth is infected, and the very back tooth looks broken off.
All right.
Over the last 12 years, the number of people visiting America's emergency rooms has soared. Yet here's what's surprising. The number of low-income people going to ERs has not increased. The increase has come almost entirely among middle-class people, and many of them have insurance.
Which insurance do you have?
Blue Cross.
Do you have your car with you?
Yeah.
So why do they go to the ER? Why aren't they seeing their own doctor?
Went home and...
Many people think that they know what's wrong with the healthcare system in this country. Millions of people are uninsured. And sure, that's part of the problem, but that's not the whole problem. The whole problem is bigger than that.
I'm up top here. Any problem up there? Any problem in the back? There's just not enough resources out there for not only your uninsured patients, but also your insured patients. The insured patients have a problem also because their doctors, when they call their office and says, I need to see, well, we can't see you for 3 weeks. Well, what am I going to do for 3 weeks?
Open your mouth.
Healthcare costs keep going up and up and up, but the access seems to be going down, 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 down. All right, do you need anything for pain right now? You do? Okay, we'll get you some. All right. And we got to run some tests and we'll be back.
Oh, okay. Thank you. I'm just glad, that there's a place to come to, I mean, dying's not no big deal to me, but, people have to go through a lot before they get there.
When I was a financial journalist at Barron's, I wrote many stories about health care. And what I learned was that much of what we think we know about health care isn't true. And much of what is true is counterintuitive. So eventually I decided to write a book about health care. And when I did, I knew I wanted to talk to a lot of doctors. So I began putting out phone calls. I didn't know most of the doctors I was calling. I was hoping that maybe 20% of them would return my call. To my utter surprise, 5 out of 6 of them called me back. And they talked. They talked for 30 minutes. They talked for longer than that. They said, please, we want someone to know. Please tell people. To a man and to a woman, what they were most passionate about was the declining quality of care in this country. Not about how much they were paid or how much they weren't paid. They were concerned about the quality of care, about what was happening to their profession, and how little power they had to do anything about it.
it is, I guess, politically correct, widely believed, that to say that American healthcare is the best in the world. It's not. There's a much more complicated story there. For some kinds of care, my colleague Brent James calls it rescue care. Yes, we're the best in the world. If you need very complex cardiac surgery or very advanced chemotherapy for your cancer or some audacious intervention with organ transplantation, you're pretty lucky to be in America. You'll get it faster and you'll probably get it better than in at least most other countries. Rescue care, we're great. But most healthcare isn't that. Most healthcare is getting people with diabetes through their illness over years, or controlling the pain of someone with arthritis, or just answering a question of someone who's worried, or preventing them from getting into trouble in the first place. And on those scores, chronic disease care, community-based care, primary care, preventive care, no, we're nowhere near the best. And it's reflected in our outcomes. We're not the best healthcare system in the world in infant mortality rate. We're like number 23. There's an index that is used in rating healthcare systems, which is the rate of mortality that could have been prevented by healthcare. There are at least a dozen countries with lower rates of preventable mortality than the United States, and not one of those countries spends 60% of what we do on healthcare.
I have a great job, but I live like a pauper because I basically spend all of my money servicing the debt that I accrued while I was sick. In 2004, I was working as a documentary film producer. I wasn't making a lot of money, but I knew that keeping up my health insurance was a priority. I was afraid that I would break my arm snowboarding or take a fall at work. I picked up the phone and I said, I would like to buy some health insurance, please. And this is the outcome. I ended up almost $100,000 in debt after being diagnosed with breast cancer, having surgery, chemotherapy, radiation. Some of these things I just put them on my credit card because I thought, if I don't die, I'll deal with this later. I pay something around $1,800 a month towards all my debt related to my illness, both the tens of thousands of dollars that I paid because my insurance didn't cover me.
Perfect. Where is it? So you think you're insured? Think again, and it's a very, very powerful story by our national political correspondent, Karen Tumblety, about her brother's illness and how she herself was an expert in healthcare. She moderated a presidential forum on healthcare. Her brother is losing kidney function, so she said, I'll figure it out for you because I know all this about healthcare. And she just got into this horrible maze of trying to figure out how to get her brother care. And he was buying short-term medical policies every 6 months, and he didn't realize that each time he renewed, they treated him as a new patient. And it's really a cover story about not the uninsured, but the underinsured. There are about 25 million Americans who don't have adequate healthcare insurance, and they're just one illness away from disaster and bankruptcy. In fact, what we've seen is that study that showed that about half of all bankruptcies in America have to do with the fact that people can't cover their medical expenses.
I agree with Howard Dean that health care reform bill without a public option is not health care reform at all?
Yes.
Yeah. Why?
Because we've gotten derailed about it's all about access and spending more money and sort of balancing the budget, the healthcare budget. There are two things I think that we forgot to talk about, and that is not just people who don't have any insurance, but the underinsured. If you needed a snapshot of what those people looked like, you look at the forum in Inglewood, California this last few days. Amazing. Yep. Amazing, sad, stunning, and awful. Yeah. And remember, it was just a year or so ago that we saw the same people in stockyards in Virginia outside of Washington, D.C. These are American citizens who hold jobs, who are paying their taxes, who are lining up for free health care because they don't have it. So it isn't about the government overtaking things. It's about access to something.